Walking. Don't we always want to walk? When someone is unable to walk and they have had a stroke, the most common question I've been asked is, when will I walk again? So walking is an important exercise intervention that should be done in people who have had a stroke. Gait speed is now considered the sixth vital sign, just like your heart rate, blood pressure, your rate of oxygen. So why is it considered the sixth vital sign? Is because it's reliable, it's valid, and sensitive. It predicts the future health status and a functional decline in a person, and it also helps predict if this person is going to take a fall. It can be very easily accessed in simple environments like outpatient clinics, even in the hospital settings, and even at home. So walking speed at which one is able to walk becomes an important criteria. As you can see in this diagram, people who can walk at more than 0.8 meters per second will be considered community ambulators, which means they will be able to walk outside and have some form of ability to do their functional activities in the outside world. However, if your speeds stay between that 0 to 0.4 meters per second, you will not be able to go out as much. So encouraging people who have had a stroke to always work on their speed of walking is helpful and also will help reduce their risk of falls. So the evidence for improving someone's ability to walk or the speed of walking is for high-intensity gait training. There's a lot of evidence for that, and in today's day and time, most physical therapists will work with you to do their best to make you walk as much high intensity as one can tolerate. So it becomes important as a healthcare provider to encourage people who have had a stroke to walk faster than what they would normally walk so that they can increase that intensity with walking. Why do we want that high-intensity gait training for the person? It's been found that if someone who just walks at home or in the hospital, they tend to take less than 300 steps a day compared to someone who will walk on a treadmill. In this study, which was done by Hornby et al. In 2015, they found that the median stepping activity of 1,500 steps per day is much less than 300 steps per day in a typical inpatient rehab setting, which means in the hospitals, one cannot really walk that much. You tend to stay in the bed. So it becomes important that we really make our patients or people who have had a stroke, encourage them to walk as much as possible. Doing this high-intensity gait training, be it on your treadmill, be it on the ground, will help improve that number of steps that one takes. What are the key factors when you're thinking about high-intensity training? Are the number of steps. How intensely did this person take them? Were they strolling for like 30 minutes? Or were they actually brisk walking as much as their body allowed while their heart rate was being monitored? How specific are we doing this? If one wants to walk streets that are uneven or wants to walk maybe on a park or an uneven ground, if this person has never trained on those surfaces, you won't have success. So it becomes extremely important that someone actually trains on those areas and spaces so that the task becomes extremely specific. So walking on uneven surfaces is equally important as walking in flat surfaces. The more the variability is, the greater the improvements. But what does the variability actually mean? Oftentimes, we think about walking just forward, but that's not true. We sometimes have to walk backwards. Maybe somebody walked right past you, and you have to give them some space, and you have to take a couple of steps backwards. You have to sometimes walk sideways, maybe squeezing through those lines and being in busy environments. Sometimes we need to walk sideways. So we also need to remember that walking forward is not the only task one should do. You should also practice walking forward, sideways, going up the hills, going down the hills, and also walking on soft surfaces, maybe over ground, maybe over leaves. And if that's not possible, then having some foam surfaces in the house to help walk and improve that function over uneven surfaces. What is the recommendation from the literature? High-intensity gait training is defined as having aerobic exercises within that 70 to 85% of that heart rate max. But still remember, if you've not been tested before, your testing has not been completed in terms of your heart rate assessment, oxygen assessment, it is not very safe to do exercises at 85% of heart rate maximum. It is better that you discuss those things with your physical therapist or also with your MD to figure out if a graded test can be done on you. And in case you can't get it done, then you lower the intensity within that 40 to 70% of your heart rate maximum. Want to target at least 3 to 4 days per week, and you don't want to worry about how you walk. The key goal is we get to walking. Walking, and walking. That's what will help someone to walk longer distances, be a community ambulator, and encourage your partners or your friends or your patients to at least walk close to 2,000 steps in a day. So walking between 2,000 to 6,000 steps is the usual walking protocol that will really benefit the patient. Along with gait training, like I mentioned before, it is important that you also do task-oriented training, which involves, adapting oneself to very salient environments. You may not just walk. You may have to walk, sit down, get up again, turn around, and maybe make a conversation with someone. So doing that as a circuit training also helps. So you're walking, maybe put up some stairs for someone, have them walk, go up the stairs, come down the stairs, and walk again, and maybe have them sit down and make them stand up. So this way, this person is now able to walk, do the stairs, and walk back, and then sit down. So this is how the neuroplasticity of the brain will work. So this is what circuit training usually involves when patients come to the clinic for stroke rehabilitation. As a caregiver or as a healthcare provider, it's important that one is encouraged to consider doing task-oriented practice and not just plain walking. So combining the two is found to be beneficial. Repetition during that circuit training is again very important. You continue doing exercises for a higher number of repetition, the better the neuroplasticity. Like I was saying before, just doing gait training, which means just training someone for walking, may not be as beneficial as actually including other tasks during that gait training. There is evidence that circuit training is found to be more effective than just doing gait training in people who have had stroke. Oftentimes, the foot does not work. And that's a big challenge for someone who cannot walk. So the common question that is often asked is, how do I go about walking when my foot drags? There are certain equipment that the people who have gone through a stroke and whose feet don't really move well can use to help them walk better. And they are called the ankle foot orthoses. It's a device that can be used around the foot to help patient walk better. Along with these equipment, there are some functional electrical stimulation equipment, which means that you're providing the electrical stimulation to people who have had this dysfunction around their foot, and you're supplying this electrical stimulation to their muscles. There is key recommendations for that. One should always provide an ankle foot orthosis or even an equipment for functional electrical stimulation in case you want to improve someone's quality of life. It should also be provided in order to improve someone's speed of walking. If a patient can walk for 0.4 meters per second without the orthotics, and if you provide those orthotics or you provide functional electrical stimulation and their walking speed now increases to 0.6 or 0.8, you've actually moved this person from being a household ambulator to a community ambulator. So encouragement should be given to patients or people who have had a stroke to make sure that they do wear an orthotics when they especially walk. You should also consider doing orthotic intervention for people who may have balance dysfunction. Foot is the first segment that helps with balancing. And in case the foot is unstable, what will happen? Someone can end up with a sprain on that foot because it's just so weak. So these orthotics also help out with providing that support system to the foot and thus helping out with your balancing. Functional electrical stimulation. So, where should we actually provide the stimulation? Oftentimes, we think about supplying it to the foot muscles, but it's been found that if you actually supply some of this stimulation to even your hip muscles, your gluteus medius, that's the side of your hip, it will help improve your ability to walk. And along with all of this, use of mirrors really helps. Why use of mirrors? There are certain neurons in the brain that really help people to understand how they are walking, because as you know, we will see the reverse image of ourselves as we look into the mirror. So when you're walking, you're actually looking at your left side. If your right side is impaired, that it's your left side that's actually working very hard. And that left side of the image looks like the right side. So in a way, we can trick the brain to work harder by using those mirror neurons. So combining the two interventions, using electrical stimulation and also use of mirrors for that visual feedback and use of the mirror neurons to improve someone's function is important.